so we're going to be administering a secondary IV medication. Our order is for Zosyn. Secondary is also known as a piggyback. So before you do anything, you want to make sure you do your 6 rights, which is the right patient, the right drug, the right time, the right dosage, the right route, and the right documentation. So the route today is going to be through IV. You want to first introduce yourself to the patient. Good morning, Mr. Smith. I'm Cherry. I'm going to be administering your medication today. The doctor has ordered you to receive some antibiotics via IV. This Zosyn medication is going to help prevent or treat any bacterial infections. So, can you please state your full name and your date of birth? Can you tell me if you have any allergies, especially if you have an allergy to penicillin? No allergies? Okay, great. So after we administer, some of the side effects that you might experience may include diarrhea or even a rash. So if you have any of those, please let us know so that we can treat that for you, because you might be having an allergic reaction. So it's important to let us know. So we have our medication. The order is for 3.375 for a 50 milliliter bag. We want to make sure that we administer the Zosyn over 30 minutes. So the drop factor that we've calculated is going to be 25 drops per minute, which I am going to set on the drip chamber when I hang it. You want to know the compatibility. So for specifically Zosyn, you don't want to mix it with any other medications. It is okay to mix it with IV fluids, just to name one, lactated ringers. So I'm going to go ahead and check. He is receiving lactated ringers, so that's good. We know that the compatibility is fine. Alright, so what I'm going to do first is just set up my supplies. So I want to warm hand hygiene and don clean gloves. So the first thing you want to do is you want to get your secondary IV tubing that I've already opened. You want to make sure that the clamp is closed. And then you want to practice sterile techniques, so you want to make sure that you have some alcohol tabs handy. But what you're going to do is you're going to spike the bag. So you're going to pull this tube off, like so that just twists off, and then you're going to pull, making sure you don't touch anything, and you just insert it into the opening, making sure that you don't pierce through the side. Alright, so there we go. And then you want to make sure that you get rid of any air in your tubing, minimizing as much waste as possible, because you don't want to waste your medication. So I'm going to go ahead and do that now. So what you do is you would uncap this, making sure you keep this clean and not contaminating it. You open up your clamp. You want to make sure you prime your drip. Okay, so minimum drops wasted. And so you know that you've primed it correctly when you don't see any air in the tubing. Right, so with your secondary medication, you want to make sure that it is hung higher than your primary. So I'm going to go ahead and hang this up. And you get your, before you connect it, you want to make sure that you clean the hub on the primary to prevent any infection or contamination. So you clean that for about 15 to 30 seconds. So after that's clean, you can go ahead and connect it. So before you unclamp it and start your IV, you want to lower your primary so that the drip chamber is lower than your secondary. So once you have that set up, you want to set up your drip chamber with the clamp to make sure that it is 25 drops per minute. So I'm going to go ahead and do that. And so when you have that done, you'll see your chamber drop. And once you set that up, you want to make sure that your IV is, check your site, make sure there's no complications, and then you want to come back in about 30 minutes just to make sure that your patient isn't having an allergic reaction. And that's it.